I would say approximately 10 or 11 days ago, I started coughing. Like at this time of year, that's not very unusual for me. A few years ago, I ended up getting bronchitis, and as a result, I do sometimes have bronchitis flare-ups. So I didn't really think anything of this particular episode. So I didn't think anything unusual about this particular flare-up. I do have bronchial asthma, which was diagnosed several years ago. I guess that started as a result of a cough that I had, and I didn't think anything of it. This was many years ago. I didn't really think anything of it, and I went to a walk-in clinic, and the doctor at the walk-in clinic just told me that I have a throat infection. She gave me some amoxicillin, which is a form of penicillin, to treat that throat infection. However, it didn't do anything. I ended up going to another clinic a couple of weeks after that, and I was told by that doctor that I had bronchitis. So they gave me a series of medications. I find and some of those medications were just not effective. So I found that the most effective medications that they prescribed to me. So I have a blue, what you call a rescue inhaler, and this medicine is called, this particular medicine is called Ventolin. And this purple inhaler, this particular medicine is called Advair. Oops, sorry. I had my finger over the microphone there for a second. Yeah, this particular purple inhaler, this medicine's called Advair. Both of these are obviously prescription medications. So anyways, fortunately, I don't have asthma severely, and bronchial asthma is an even more rare occurrence for me. It's a very rare occurrence. Like my asthma inhaler, last year, I don't think I had to use my blue rescue inhaler one single time last year, the asthma inhaler. The blue rescue inhaler, of course, is for when you're short of breath. Then that will immediately restore your breath and get you breathing properly again. And the purple one is for if I have a bronchitis flare-up. The purple one, I've used that a few times over the last week or so, thinking that it was a bronchitis flare-up I was having. So, as I was saying, I was coughing, but this particular time, like over the last 10 or 11 days, like my coughing started about 10, 11 days ago. Today is Tuesday, January 15th. So Tuesday, January 16th. My coughing started about 10, 11 days ago, I guess on Friday, January 5th. But it was particularly intense this time, to the point that it was very, very uncomfortable, very annoying, very frustrating to deal with. And there was one day that I actually spent in bed, Sunday, January 7th, because I was just really feeling lousy. I was coughing so much that day that my head was hurting. So anyways, I went to the drugstore, and a pharmacist suggested to me some Benylin cough syrup. The Benylin cough syrup did help to calm down my coughing a little bit. And also, I also went and picked up some Sucrets as well too, which is supposed to suppress coughs and sore throat relief and make nasal passages feel clearer. So that did soothe my throat a little bit, but I was still coughing. So last week, Friday, So January 12th, I went to an urgent care clinic to find out, to tell them about my coughing and all that and find out what's going on. And they ran they did a couple of their normal tests on me, including checking my throat and all that. But then one of the other tests they did, they took 2 chest x-rays from me. So the doctor took a look at those chest x-rays at the time and said that she couldn't see anything concerning on my chest x-rays, that I don't have bronchitis or anything like that. However, she said that she would have the radiologist take a more clear look at my chest x-rays when the radiologist gets in the next morning on Saturday. I guess that'll be Saturday, January 13th. Excuse me if my voice sounds kind of raspy as well too, like I am still dealing with sickness and all that. So the radiologist came and checked my chest x-rays on Saturday, January 13th, sorry, it's definitely not June, January 13th. I got a call Saturday morning that I have a minor case or a mild case of pneumonia. That's right, yeah, I was told that I have a mild case of pneumonia. Like, she said it was just a slight touch of pneumonia. They saw a couple of stripes on one of my lungs. And I guess you could call it walking pneumonia, which really surprised me because I generally associate pneumonia with people. I generally hear about elderly people over 65 and older getting pneumonia, and sometimes you hear about babies and very small children getting pneumonia. But I mean, I'm a young, healthy adult, so I was a little surprised to hear that I had pneumonia. And also the reason why I was kind of surprised to hear that I had pneumonia is because the only symptom I had was coughing. Like, I'm going to show you some of the symptoms of pneumonia shortly, but I didn't have any other symptoms apart from coughing. So that particular doctor prescribed to me, my camera doesn't seem to want to focus here, some antibiotics called amoxicillin/clavulanic acid. So these are the antibiotics that I'm supposed to be taking for my pneumonia for a period of 7 days. So I got 21 tablets. I've got to take one every 8 hours. And then I'm going to be finished them this coming Saturday, January 20th. And approximately two to 3 weeks after I finish my pneumonia tablets, I'm supposed to go back for another chest x-ray to make sure that the pneumonia is gone. Like, other than that, like, I've been feeling fine. Like, I've been out and about and I've been feeling fine over the last week or so, apart from this annoying cough. So anyways, and by the way, the reason I'm doing this video, I'm not doing this video to look for pity or anything. The reason I'm doing this video is to educate people and tell them a little bit about pneumonia and how basically anyone, even a young healthy adult, can catch pneumonia. And if you catch it in the early stages, you just have to go and get some medication for it, some antibiotics. Like, this 7-day supply of antibiotics only cost me $23. So it's not that expensive to treat. But if you don't treat pneumonia quickly enough, it can have possibly fatal consequences. So right here really quickly, what is pneumonia? Pneumonia is an infection in one or both lungs. It can be caused by bacteria, viruses, or fungi. Bacterial pneumonia is the most common type in adults. Pneumonia causes inflammation in the air sacs in your lungs, which are called alveoli. The alveoli fill with fluid or pus, making it difficult to breathe. So the symptoms of pneumonia. Pneumonia symptoms can be mild to life-threatening. The most common symptoms of pneumonia can include coughing that may produce phlegm, mucus, which I have been coughing, and at times I've been coughing up phlegm. Fever, sweating, and chills. I never really experienced any of that. Shortness of breath. I didn't experience any shortness of breath either. And chest pain. At times, as a result of heavy coughing, I'll experience some very minor chest pain, but nothing significant at all. Other symptoms can vary according to the cause and severity of the infection, as well as the age and general health. Of the individual. So symptoms by cause. Viral pneumonia may start with flu-like symptoms such as wheezing. A high fever may occur after 12 to 36 hours. And bacterial pneumonia may cause a fever as high as 105 Fahrenheit, which is approximately 41 degrees Celsius, along with profuse sweating, bluish lips and nails, and confusion. Symptoms by age. Children under 5 years of age may have fast breathing. Infants may vomit, lack energy, or have trouble drinking or eating. Older people may have a lower than normal body temperature. So what are the types and causes of pneumonia? The major types of pneumonia are classified by the cause of the infection, where the infection was transmitted, and how the infection was acquired. Types by germ. Pneumonia can be classified according to the organism that caused the infection. So you have bacterial pneumonia. The most common cause of bacterial pneumonia is Streptococcus pneumoniae, Chlamydophila pneumonia, and Legionella. Legionella pneumonophila can cause bacterial pneumonia. So it goes through the different types of pneumonia there. You have viral pneumonia, mycoplasma pneumonia, fungal pneumonia. So there's different types of pneumonia. You even have hospital-acquired pneumonia. This type is bacterial pneumonia, is acquired during a hospital stay. It can be more serious than other types because the bacteria involved may be more resistant to antibiotics. Community-acquired pneumonia. This refers to pneumonia that is acquired outside of a medical or institutional setting, which is what I have. So types by how they're acquired. Aspiration pneumonia. This type of pneumonia occurs when you inhale bacteria into your lungs from food, drink, or saliva. This type is more likely to occur if you have a swallowing problem or if you become too sedate from the use of medications, alcohol, or some types of illicit drugs. Ventilator-associated pneumonia. When people who are using a ventilator get pneumonia, it's called VAP. Great, my phone doesn't want to focus. Is pneumonia contagious? Most kinds of pneumonia are contagious. Both viral and bacterial pneumonia can spread to others through inhalation of airborne droplets from a sneeze or cough. But while you can become infected with fungal pneumonia from the environment, it doesn't spread from person to person. Who is at risk of pneumonia? Anyone can get pneumonia, but certain people are at higher risk. Infants from birth to age 2 years, and individuals age 65 years or older, people who have had a stroke, have problems swallowing or people that are bedridden, people with weakened immune systems because of disease or use of medications such as steroids or certain cancer drugs, people who smoke, misuse certain types of illicit drugs, or drink excessive amounts of alcohol, people with certain chronic medical conditions such as asthma, cystic fibrosis, diabetes, or heart failure. How is pneumonia diagnosed? Your doctor will start by asking you questions about when your symptoms first appeared and about your medical history. They'll also give you a physical exam. This will include listening to your lungs with a stethoscope for any abnormal sounds, such as crackling. Your doctor will also likely order a chest x-ray. Typically, pneumonia can be diagnosed with the physical exam and the chest x-ray, but depending on the severity of your symptoms and your risk of complications, your doctor may also order some more tests, such as a blood test. This test can confirm an infection, but it may not be able to identify what's causing it. A sputum test. This test can provide a sample from your lungs that may identify the cause of the infection. Pulse oximetry. An oxygen sensor placed on one of your fingers can indicate whether your lungs are moving enough oxygen through your bloodstream. A urine test. This test can identify the bacteria Streptococcus, pneumoniae, and Legionella, pneumophila. Sorry if I'm struggling with these medical terms. A CT scan. This test provides a clearer and more detailed picture of your lungs. A fluid sample. If your doctor suspects there is fluid in the pleural space of your chest, they may take fluid using a needle placed between your ribs. This test can help identify the cause of your infection. A bronchoscopy. This test looks into the airways in your lungs. It does this using a camera on the end of a flexible tube that's gently guided down your throat and into your lungs. Your doctor may do this test if your initial symptoms are severe or if you're hospitalized and your body is not responding well to antibiotics. How is pneumonia treated? Your treatment will depend on the type of pneumonia you have, how severe it is, and your general health. Prescribed treatment, antibiotic, antiviral, and antifungal drugs are used to treat pneumonia, depending on the specific cause of the condition. Most cases of bacterial pneumonia can be treated at home with oral antibiotics, and most people respond to the antibiotics in 1 to 3 days. Your doctor may also recommend over-the-counter medications to relieve your pain and fever as needed. These may include aspirin, ibuprofen, such as Advil or Motrin, and acetaminophen, such as Tylenol. Your doctor may also recommend cough medicine to calm your cough so you can rest. However, coughing helps remove fluid from your lungs, so you won't want to eliminate it entirely. Home treatment. You can help your recovery and prevent a recurrence by taking your drugs as prescribed, getting a lot of rest, drinking plenty of fluids, not overdoing it by going back to school or work too soon. Hospitalization. If your symptoms are very severe or you have other health problems, you may need to be hospitalized. At the hospital, doctors can keep track of your heart rate, temperature, and breathing. Treatment may include intravenous antibiotics. These are injected into your vein. Respiratory therapy. This therapy uses a variety of techniques, including delivering specific medications directly into the lungs. The respiratory therapist may also teach you or help you to perform breathing exercises to maximize your oxygenation. Oxygen therapy. This treatment helps maintain the oxygen level in your bloodstream. You may receive oxygen through a nasal tube or a face mask. If your case is extreme, you may need a ventilator, a machine that supports breathing. What's the outlook for pneumonia? Most people respond to treatment and recover from pneumonia. However, for some people, pneumonia can worsen chronic conditions or cause complications. Recovery, like your treatment, your recovery time will depend on the type of pneumonia you have, how severe it is, and your general health. A younger person may feel back to normal in the week after treatment. Others may take longer to recover and may have lingering fatigue. If your symptoms are severe, your recovery may take several weeks. Worsened chronic conditions. If you have certain health problems already, pneumonia could make them worse. These conditions include congestive heart failure and emphysema. For certain people, pneumonia increases their risk of having a heart attack. Potential complications. Pneumonia may cause complications, especially in people with weakened immune systems or chronic diseases, such as diabetes. Complications can include bacteremia, bacteria from the pneumonia. Infection may spread to your bloodstream. This can lead to dangerously low blood pressure, septic shock, and in some cases, organ failure. Lung abscesses. These are cavities in the lungs that contain pus. Impaired breathing. You may have trouble getting enough oxygen when you breathe. You may need to use a ventilator. Acute respiratory distress syndrome. This is a severe form of respiratory failure. It's a medical emergency. Pleural effusion. If your pneumonia is not treated, you may develop fluid around your lungs and your pleura. The pleura are thin membranes that line the outside of your lungs and the inside of your rib cage. The fluid may become infected and need to be drained. And in your worst case is death. In some cases, pneumonia can be fatal. Between 2 and 3 million people per year develop pneumonia in the United States, and of these, about 60,000 die. Can pneumonia be prevented? In many cases, pneumonia can be prevented. Pneumonia vaccine. The first line of defense against pneumonia is to get vaccinated. Ask your doctor about the 2 pneumonia vaccines, which can help protect against bacterial pneumonia. Pneumonia can often be a complication of the flu, so be sure to also get an annual flu shot. According to the National Institutes of Health, pneumonia vaccines won't prevent all cases of the condition, but if you're vaccinated, you're likely to have a milder and shorter illness and a lower risk of complications. And there's 2 types of pneumonia vaccines that are available in the States. Your doctor can tell you which one might be better for you. One of them is Prevnar 13. The other one is Pneumovax 23. And other prevention tips. In addition to vaccination, there are other things you can do to avoid pneumonia. If you smoke, try to quit. Smoking makes you more susceptible to respiratory infections, especially pneumonia. Wash your hands regularly with soap and water. Cover your coughs and sneezes and dispose of used tissues promptly. Maintain a healthy lifestyle to strengthen your immune system. Get enough rest, eat a healthy diet, and get regular exercise. So again, I'm not doing this video to look for any kind of pity or anything like that. I'm doing this video to let you know that anyone can get pneumonia. So if you have any unusual symptoms, it can be something as simple as a cough that won't go away in a few days. Go to your doctor, go to a walk-in medical clinic, go to an urgent care center. Or if it's more serious, like let's say you're starting to have trouble breathing or anything like that, of course, call 911. Get to an emergency room. So I know that this has been a particularly bad winter, at least here in parts of Canada, and I think parts of the States as well. It's been a particularly bad winter, and I know of a lot of people that are sick. I'm not someone who gets sick that often, and usually when I do get sick, I don't get anything serious, and I can usually carry on and function as is, which in this case, I've been able to carry on and function pretty normally. But if you get sick, if you get any unusual symptoms, better to be safe than sorry. Go see your doctor. There's nothing wimpy or unmanly about going to see a doctor if you're not feeling well. However, if you're not feeling well, the worst possible thing you can do is ignore it, because it can get a lot worse, and in some cases, it could cost you your life. Please like, share, subscribe, and comment. Thanks for listening.